And hello and happy Thursday morning to you. Welcome to another edition of the Seniors Blue Book Suncoast Senior Living Hour, heard exclusively here on your information station for all of Southwest Florida. We are WENG. It's Carrie Black. Grab your cup of joe, whatever gets you moving in the morning. We've got some great information coming your way. In fact, I have Dr. Schafer on the line with me with Coastal Orthopedics. And good morning, Dr. Schafer. How are you?
Doing well, thank you.
Good. Well, thanks for being here. I hope you're going to educate us because there's a lot going on in the world right now, but there's still things that need to be taken care of in our bodies, and that includes you guys there at Coastal Orthopedics. Can you first start by telling us a little bit about who you are?
Coastal Orthopedics has been in the county, since it's been about 50 years now.
Oh, my goodness.
It was Bradenton Orthopedics for quite a while. About 15 years ago, we changed the name to Coastal Orthopedics. Now we have 3 offices across the county. We service all 3 hospitals, Lake, Manatee, and Lake Ranch Hospital.
Oh, that's great. So been in business since, 1973, 50 years? That is awesome. That's great. So, Dr. Schafer, let's talk about Coastal Orthopedics. When I hear that name, I think about like joint replacement, sports medicine, things like that. What services do you offer?
Correct. Well, we have a practice with 19 providers.
Wow.
We have 3 offices. We have 2 outpatient surgery centers. And we have a whole line. The one thing that Coastal has done is most of our providers have been fellowship trained, so we all have our own special interests. So we have total joint experts. We have sports medicine experts. We have hand and wrist experts. We have foot and ankle guy. We have a whole spine team, which is our spine team is kind of multifaceted, where we have 2 spine surgeons. We have pain management doctors who do a lot of interventional pain injections. We have 1 physiatrist who kind of man our spine team.
Wow.
So we basically cover the whole gamut of orthopedics.
Yeah, it sounds like it. Now, do you guys offer physical therapy?
We have physical therapy on site at all 3 of our offices, and the physical therapy in our practice has been phenomenal for many years.
That's great. And what about doing, I know when people have those type of injuries and joint replacements, things like that, they need an MRI. Do they have to go somewhere else, or do you guys provide that?
We provide an MRI we tried to pick our clinic right in between the county, so it's our central office on State Road 64. So we have 1 MRI scan. We've always talked about adding a second, but as of right now, we have 1.
Okay, great. This is wonderful. If you're just joining us, good morning and welcome to the Seniors Blue Book Suncoast Senior Living Hour. We're speaking with Dr. Schafer from Coastal Orthopedics, 3 locations in Bradenton, Manatee Memorial, also 1 very conveniently located in our listening area, Lakewood Ranch, in next to the medical center there. I was reading a little bit on your website, Dr. Schafer. You guys say the coastal difference. You mentioned most of your providers are board certified and fellowship trained. How important is that?
Well, I personally think that it's very important.
Okay.
As always, what's the old saying? The jack of all trades is the master of none.
Yes.
So the problem is orthopedics has grown exponentially over how many years, and there's no way I think you can really be a general orthopedist these days and cover everything. It's just impossible. Whereas now we have guys who, they concentrate on, our joint replacement guys. They don't do spine surgery. They don't do hand surgery. They do complex total joint surgery. Then similarly, our hand specialists aren't doing ankle fractures and spine surgery. They're doing complex hand problems. So I think it's important just because it helps the patient get put in the right spot, and they know they've got somebody who concentrates and actually enjoys what they're doing. There are some general orthopedic surgeons that probably are good at a lot of different things, but there are going to be certain things they enjoy more. And so in our practice, we all find the area we're best at and what we enjoy the most. And so I think the fellowship training is important. The board certification, I thought all of our providers we pretty much have to be board certified to have privilege at the hospital.
Yep.
Probably some of our newer guys are all board eligible, so as soon as they'll all become board certified at some point.
Very cool. Well, I love to hear that, and you make a good point. When you enjoy doing something, it's probably something you're a little bit better at. So I like that you guys focus. Certain professionals and doctors like to do the specific ankle or the hand. So I like the way you explain that. Now I know things have changed a little bit. Well, the whole world has changed, but specifically to you, Dr. Schafer, and Coastal Orthopedics, what has been the reaction of the practice at the beginning of this COVID-19 outbreak? What are you guys doing differently? What about safety measures and all that?
Well, it all started late March. I remember having probably 5 surgeries on a Thursday, and it came on all of a sudden where where we had all the news of all the cases brewing up, and they wanted to stop elective surgery. As soon as the stopping elective surgery mandate came, immediately canceled all of our elective surgeries.
Mm-hmm.
We still did. Boy, during that month, I was just looking at it the other day. I don't know. We still took care of fractures. We took care of urgent cases, but we went a 6-week period where we weren't doing anything elective at all, just because of
Right.
saving the personal protective equipment and also just the unknowns. What our office did was, I thought was actually ingenious. We heard that there was one practice up in Tampa that one of their providers came down with COVID, so they had to pretty much shut down the practice.
Yeah.
So what we did was we took, maybe a third of our providers and put them at home base in Lakeland Ranch, a third of our providers at our State Route 64, and a third of our providers at the office in Bradenton near Blake. And we all kind of divided, so we didn't see each other for 6 weeks, except for the people in your teams. We broke them down to 3 teams. That way, we figured if one person got positive COVID, we could potentially extract that team for a while for the 2 weeks, but let the other 2 teams because we still needed to provide urgent care to the community. Like fractures come in, people still get hurt. So we were able to fortunately, nobody came down with it, so we didn't have to close any of those teams.
Great.
And then about 6 weeks later, we started back up with the elective surgeries again. And I'd say the one thing I'm so proud as a member of Coastal that we made the decision very early that we did not furlough or lay off any. We have over 200 employees.
Wow.
So we were able to keep them all, and we knew it would be in the long run that's the better plan, just because in a medical practice you rely on your employees so much that
Yes.
even if we had to let some people go and trying to get them back 2 months later, it becomes a challenge. So we were fortunately came through this hole. It was a challenge to do, but it was the right thing to do. So that's one thing that's for a small business our size. I thought that was we were quite happy with that.
Absolutely. We're speaking with Dr. Schafer with Coastal Orthopedics, 3 locations in Southwest Florida. Dr. Schafer, what has your experience been with COVID? You mentioned about at the clinic. What about going into the hospital? How's the experience been? Can you share a little bit?
Yeah, the hospitals have been very careful. Most of our patients are obviously not on the coronavirus floor, but all the hospitals have done a great job of they were also holding the elective surgeries early on, just in preparation for all this. They would always, the routine checks, as everyone's probably experienced already, the temperature checks, the 6 questions as you come in the door. And so it's really been just screening people at the door. And then the hospital itself for an orthopedist hasn't really affected us much. I think we've had a few patients in the hospital that have had positive testing, that have had, I think we had a patient with a hip fracture last week that had a positive test. But, it hasn't, for the most part, affected our practice at all in the hospital.
Okay.
And even in the clinic, we're not doing the same thing. We're doing the temperature checks, the masks, and everything else we can to prevent it.
Okay. That was my next question, the safety measures you have implemented in your in the clinics as well. I see, yeah, in your offices. Yeah. Mm-hmm.
Yeah, it was initially there was some debate because even the way I look at it, some of the experts early on were not necessarily encouraging masks. So I think even some of our doctors, were kind of questioning it, but then I think we all kind of came to it and said, it's probably the right thing to do. I mean, especially if you can't be distanced from the patient.
Mm-hmm.
I mean, I think there are some people that obviously you still will sit back 6-8 feet and then kind of let it slide down a little bit so you can talk to them. And I encourage patients to do the same thing. So I think we've been very careful, and it's the right thing to do.
Well, and I'm reading you've been very careful. In fact, I was on your Facebook page, Dr. Schafer, speaking with him with Coastal Orthopedics. I see that Associates voted the provider's Employer of the Year for all of your actions to make sure the staff was employed and taken care of. There's actually a thank you video on your Facebook page. That, to me, speaks volumes, Dr. Schafer.
Yeah, the video, I think, caught some of even the providers a little bit off, a little teary-eyed a little bit, because they gave us this long video of going around the whole office and how it affected some of their lives, and it was very nice of them to do that.
Well, and when you go the extra mile, it's nice to be recognized, but you guys really are going above and beyond, making sure the staff is employed. You haven't furloughed anybody. You're taking those safety measures, and for me, that makes me want to be a part of and be a patient of yours, and just being honest. Speaking with Dr. Schafer, Coastal Orthopedics, welcome to the Seniors Blue Book Suncoast Senior Living Hour. And let's go ahead and move on to, I know many surgeries are now being done on an outpatient basis, Dr. Schafer, the ambulatory surgical center. Can you talk a little bit about the criteria for those type of surgeries being outpatient? Would love to know more.
Yeah, I mean, that's obviously been a huge trend in the last even 20 years. I mean, I finished training 20 years ago, and there were cases that we would admit to the hospital for 2 or 3 days that were outpatients 15 years ago, and it's only getting more and more patients are kind of going to the outpatient setting. It's kind of the philosophy maybe that healthy patients should stay home as much as they can and leave the hospital more for the sicker patients.
Yeah, especially now. Yeah. Mm-hmm.
Yeah. So now it really comes down to sometimes it's the surgery. So if it's the big surgery, you still have to go to the hospital. The smaller surgery we've been doing at the surgery center for decades, but the big one recently is things like even total joints. We're doing a lot more total joint replacements as outpatients. Patients go home 2, 3, 4 hours later, and then and they've done remarkably well. So, and the criteria partly is just overall health. If they're reasonably healthy, and their risk factors are really low. And sometimes it's an insurance thing. Some insurances don't allow outpatient surgery. Right. And then, but most time it's just overall health and in the particular case you're doing.
Okay, case by case basis.
And you're right. And you're absolutely right with the COVID. That's a strong point that patients like, I don't want to go into the hospital if I can avoid it. And even though the hospitals do a great job to isolate and keep those patients safe, the surgery center is going to be safer. And we do test all of our patients for the virus before we do the surgery on them.
Oh, great. That's good to know. Dr. Schafer, I would like to hone in a little bit on you personally. What do you specialize in? Your training, your preferred procedures? What type of patients do you see?
I predominantly see knee and shoulder problems. I'm trained in sports medicine, but in Florida, sports medicine really means a lot of 30, 40, 50-year-olds out playing golf, tennis. I mean,
I need to come see you.
So I predominantly see sports injuries, but any knee and shoulder problem really, and that's common in our group. People will find I do a lot of knee and shoulders, and there's guys who do a lot of shoulders and elbows, and that's where we'll kind of find our niche.
Yeah, there you go. And you know what I'm noticing, not to get off subject, but just for a second, the older I get, the longer it takes for me to heal. I was moving recently and I hit my elbow on the side of something and it still is aching. And it's just, I don't like it, Dr. Schafer.
I know.
I don't like it.
It is absolutely true. Absolutely true.
Oh, funny. And, I was reading a little bit on your website. You've got something that's called, and I know people know about it, and it's in the news a lot, Regenerative Medicine. Can you tell our listeners a little bit about what this is and who can benefit from it?
Well, regenerative medicine encompasses a few different areas. The two main ones are things that we call biologics being stem cells and something else called platelet-rich plasma.
Okay.
To me, it's an exciting new technology. There's been a lot of things that come across the last 20 years, and sometimes things come up and you go, there's no way that's going to work. And sure enough, 5-10 years later, you find out that didn't work so well. Regenerative medicine, the science sounds exciting. I mean, it's you're trying to regenerate and or restore function. So if you can get cartilage cells to build new cartilage, I mean, then that helps. Or like your example, your elbow. Some people get tennis elbow, and then the platelet-rich plasma can help heal that. Instead of waiting 9 months for it to heal, maybe you can get it to heal a little faster.
Mm-hmm.
So there's a lot of the scope of biologics and regenerative medicine now is kind of all-encompassing. You can use it almost anywhere now. The problem still comes down to is even though it's exciting and the science makes sense, still a lot of unknowns. So until we've got great, very well done studies proving that it works, insurance companies still don't cover any of those shots yet, just because we're still learning from them. I've had a number of patients that swear by them. It's just a matter of hopefully over the years we'll get the science to match the studies, and we'll get it where the insurance companies will start authorizing it.
Yeah, and that's a bummer that they don't, but you guys can still do it, and just private pay is how that goes. So, Dr. Schafer, what do you see for Coastal Orthopedics in the future? I'm loving to know, because I know you mentioned before we went on air this morning that you guys are growing. Mm-hmm. You just added a couple of new spine specialists, new shoulder and spine specialists, and I can't say their names. I would try, but I don't want to mess it up.
Yes, we just added Dr. Ott and Dr. Demarkarian.
Okay.
Dr. Demarkarian is a fellowship-trained spine specialist. And then Dr. Ott's a fellowship-trained shoulder specialist, so he does a lot of complex shoulder replacements. And then we've hiring coming in pretty soon another total joint specialist.
Great.
So I see growth in the county. I mean, and we can see that there's a lot of growth out east, especially.
Okay.
So trying to expand to make sure we can maintain the growth out in the eastern counties up in Parrish, and the whole 75 corridor is just growing. So I could see us expanding our surgery center in the future. Right now we have 2 surgery centers. One has 3 rooms and the other one's pretty small. So there's been talk of expanding to get, because in the future there's going to be even more outpatient surgery. It's less expensive. It's patient satisfaction is high. Mm-hmm. Complications are low from outpatient surgery. So we know we're going to end up doing more and more outpatient surgery in the future. So that's probably a huge area of our growth in the future for sure.
Yeah, absolutely, Dr. Schafer. And, who knows what the future is going to hold with the corona pandemic. I think it maybe has changed things for the future. Who knows if we'll go back to the exact way things were. But sounds like you guys are doing a great job. You are just, doing all the safety measures. Your employees love you, because I watched the video on Facebook, and that's so great. And that makes me want to be a patient. I got to tell you, because I don't know who it was, maybe Richard Branson. It's like it's the employers that take care of their employees. That if I can't remember what the quote was, maybe you know what it is, but when your employees love you, to me as a consumer, as a client, as a customer, as a patient, that speaks volumes.
I think you're probably right.
Yeah. So, all right. Now, where can our listeners find out more about your clinics, the Coastal Orthopedic Clinics? Do you have a website, and how can they get in touch and call for more information?
Yeah, we have our website is www.coastalorthopedics, and that's orthopedics spelled ORTHOPEDICS.com.
Okay.
Our office phone number is 941-792-1404. That's by the easiest way.
All right. Perfect. And give that number again in case someone's writing it down.
I'm sorry. 941-792-1404.
Yes. Okay. Cool. Cool. I still keep a written day planner. Don't make fun of me, but I do.
No worries.
All right. Dr. Schafer with Coastal Orthopedics, thank you so much for being with us today on the Seniors Blue Book Suncoast Senior Living Hour. Thanks for educating us and letting our listeners know about the great services that you offer at your 3 clinics. Appreciate it.
I appreciate it. Thanks.